question what they will ask is how to examine the pulse. So how to examine pulse? Okay, so you stand on the right side of the patient just like what I'm doing. Okay, for example, this is the hand of the patient. Okay, so you use your right hand. Okay, and put 3 fingers on the radial artery. So where is the radial artery? Every one of you know radial artery is always towards the thumb. Always. Okay, the patient's hand should be in the supine position towards the thumb. Here the radial artery is fed. So one of you come in, also in him, so that you can easily see this. For example, this is thumb and here is the radial artery, exactly here. Clear? I can palpate. There's very good radial artery pulse, radial pulsation. Okay, so 3 fingers and the middle finger is actually feeling it. And now what you do, you have to wear the watch. Wearing watch is very necessary in the exam. You start from one time and count for 15 seconds or 30 seconds. It's up to you. Sometimes even 10 seconds is fine. Okay, but do not forget how many seconds you have counted, and you have to multiply by certain number. If for 30 seconds you need to multiply by just 2. 15 seconds you have counted, you have to multiply by 4. 10 seconds you have to multiply by 6. So what we want is either 15 seconds or 30 seconds. 10 seconds is a bit less. Okay, count it and report to the examiner. That is how you palpate the radial pulse. Now, where is the brachial pulse? Where is brachial pulse? Brachial pulse is present in the cubital fossa. Cubital fossa. This is called cubital fossa, right? Now see here, this is a perfect position, and brachial pulse is always present towards the middle side. Okay, medial side. This side. This is lateral. This is medial. There are 2 ways how to find it. If I feel here, this bone here. Okay, this bone. There's a pointed bone on the middle aspect of the elbow. This is the medial epicondyle. Very easily felt. Okay, right here. You just put 2 of your finger from the medial epicondyle and you put the thumb. See this? I'm exactly on top of the brachial pulse. This is one way, and another way is also there. This is a biceps tendon. So when you flex it, you can easily feel the biceps tendon at the middle of the elbow. Okay, brachial pulse is medial to the biceps tendon. Medial. This is right here. Why it is so important, dear student? If you don't know where is this pulse, you can never measure the blood pressure. Because to measure the blood pressure, you need to put your stethoscope over this artery. Do not guess it. So many students just guess, they put here, very medially, or very inferiorly or superiorly, and they don't hear any sound. This is so important. We are watching here. Okay? This is brachial pulse. These are the 2 things which we ask very commonly, and third thing is a carotid pulse. So where is carotid pulse present?
The neck.
Neck. Now see this, in him it is very easy. See, this is thyroid cartilage. Even in girls we can feel it very well. Okay, just roll your finger, the thumb. Okay, roll your thumb lateral, and there is this muscle is called sternocleidomastoid muscle. So in between them there is one hollow area, right? Just press at that hollow area. The carotid pulse is very strong pulse. It will hit your finger. Okay, this is the way. And do not press on both sides together. Okay, don't do that. It doesn't look good, and patient may feel dizzy also. You know why? Because you are blocking the blood flow to the brain. There's one reason, and another reason is also there. You stimulate the vagus nerve. Vagus nerve. Okay. So what is the function of vagus nerve on the heart? Exactly. Decrease contractility and decrease heart rate both. So there will be decreased cardiac output and decreased blood flow to the brain. And you are doing it, so patient may feel dizzy. Okay. So one at a time, like this, and like this. Okay. Very strong pulse. You don't need to feel again and again. These are the 3 things in the pulse. So let me repeat again. One is radial, another is brachial, third is carotid. These are the things we will love to ask.